There are many other advances that are taking place in real time. We're better understanding how vaccine-based therapies, there are stem cell delivered immune modulating agents. We're better understanding the radiations, therapeutic effect and how that can be synergistic with immune therapies in terms of release of tumor antigen and engagement by immune-based therapies. Again, the checkpoint inhibitor experience thus far had not panned out to be successful, but we are hoping to see whether in the neoadjuvant setting, so kind of priming the immune system to be active and in anticipation of a surgical resection is another approach that is being taken. And I would say lastly, it's the combinatorial approach, that in the upfront setting, providing immune-based therapies followed in conjunction with other targeted therapies that might also be immune-based in the recurrent setting. I think that's where we have the most potential to impact all patients. And actually, I would say the third and maybe last point that I wanted to share was we are gleaning a much better understanding of who are the early responders to therapy and which patients might be, showing signs of tumor progression early on. And that pivot point, so basically the timing between determination of that a treatment has worked or that it is time to actually move forward with the next approach is something that we are very hopeful that the power of AI and other technologies that can synthesize the data in this precision approach is also, that it's independent of one singular, approach of a specific type of therapy, but rather that approach of better understanding in real time what signatures might be present to enable clinicians to manage and treat each individual GBM patient in the most optimal way.